Any doubts that you may have, please raise your hands and I will try. What's that? What they will do with the paper that they fill out? Leave it on the table. Thanks, Senator. Okay.
I think Johnny gets his hands right.
Yeah. Justify my presence here. Tell me. Let me, I don't know if you, thank you.
I'm gonna walk around. If you got any questions, hold them hands up.
Okay, I just have one question. First of all, your presentation is great.
Thank you.
I noticed you didn't say anything specifically about diet, exercises, or other options. The focus seemed to be really on joint replacement. So I was wondering in those other areas, like what are some recommendations for people to do other than going straight to the surgery?
Absolutely. I think that we brought up a big point. Again, you have to think that anything that overstress the weight supporting that your joint is going through. So you see here, all my weight is over my hips and my knees. So if I'm having something, if I'm carrying on a stone, this will be more effective because I'm imposing an oak weight. So anytime that you increase your weight, stop, thinking the solution. Go to dietitian. Start to thinking about how you can manage your weight to avoid this extra, you are extra imposing more damage to your knee. So you have to be very mindful about that. Don't take any risk. If we're starting to notice, and this is part of the aging, get a little bit more weight is part of the aging. It's natural, not necessarily. So, but we have to be mindful about it. As less as you solicit your joints, healthier they will be. Clarified? Thank you. Sure.
And again, also thank you for the presentation.
Thanks.
And the information that you shared. I was told back in 2022 there was research being done for artificial joint herniation. What can you tell us about what research is now?
This is pretty much about artificial joints. It's exactly what I told you. It's the joint replacement.
Between the joints is what I'm looking for. The research for cartilage is between the joints. Because that's what wears out, it's not disturbing the bone.
Yes. The cartilage is the starting point. So the disease, the osteoarthritis will start in your cartilage. But after some time, because of the bone beneath it will figure out that something is going wrong, and he will start trying to help the cartilage above. So at some point will be a full disease of osteo and arthritis. So this is why the name is osteoarthritis, because it's a conjunction of the two structures. So both will be.
Replace just the cartilage.
There is some there is some being done. Nothing today that I can say to you that, okay, there is an option for that already in place. But there is some studies being done.
I'm coming around. We got some more here for coming. Next thing you need the microphone.
Okay, I know you're talking about the knee and everything. I want to know about the back. I got the back. I got two people up here against nerve arthritis. If one can go in there, it'll stop your mind of the head, stop the left. So they're like in my 40 years there. Then my knee, like fit my cartilage, deteriorating. And then they never fit my nail spot.
Remember that I mentioned that systemic disease. So can be, and the spine as well is a very supportive joint. So can be happening anywhere in the body. So can be in your spine and can have some other unfold situations related to that. So again, the same measures, the same takeout that you were talking about knees and hip, same applicable to the spine. Because it's a systemic disease, so can be anywhere in the body, can be just in the hands. So you see a lot of people that has, the articulations in the hands swallow, increase. This is osteoarthritis as well. So, it's a systemic disease. Can affect any joint in your body. It's more prevalent in the joints that support weight. So spine, hips, and knees. Same measurement, same take care that you should do that you should do for hips and knees. You should take care same way in your spine.
Dr. We're glad to have you today. My question is, what can we do to build cartilage?
Say it again.
What can we do to build or strengthen our cartilage?
That will be wonderful if you can do something that specifically driven to the cartilage. But there is some things that you can do. The things that you can do or you can avoid is be active. Movement is a big thing for the articulation. Because as much as you move, we have a liquid inside the articulations, all of them, all the articulations that protect your joints. As much as you move, more productive will be the tissues that produce this liquid. So your cartilage will be more protected if you keep moving. The muscles around the cartilage, around the joint, has to be strength. So keep moving. This is the best thing that you can do. Avoid overweight, keep moving, keep healthy and activity, and that you will be protecting your cartilage very much.
We're going to have a couple more questions. I know I got some over there. We got to keep moving.
If you have a pain, how do you know whether to use a hot or cold compress?
I couldn't hear, so I'm sorry.
If you have a pain, how do you know whether to use a hot or cold compress?
It varies, but the response will be very individual. Me, for example, I hate any treatment with cold. So don't ask me ice on my joint because it will aggravate my pain. So this is individual. There is a lot of people that think that when they put ice on the joints, have a very good result. So it varies, but hot and cold both can help. It's a matter of preference. It's a matter of how this works better for you. Pick one and go.
Thank you for taking my question.
Sure.
So how long does a total knee replacement or a partial knee replacement, how long is it good for before you have to redo it?
So, great question. Now, what the studies are showing is that with the advance of technology, we have 10 years lasting until you have to do something else. So 10 years. It's a great number, isn't it? So 10 years of no pain, 10 years of activity, it's a great number.
Thank you for answering the question.
Sure.
I've had knee surgery for both years. The second surgery I had, it was long. I had suffered that for 2 years. Now I've got new knee, and it's not good. It's just happening. I'd like to know just how long am I supposed to go through this after the doctor has
I'm very sorry to hear that. I didn't know what's going on. I don't know what is the cause of the situation that you're facing.
to start out because of the wrong knee.
Yeah, probably, I would need to see the x-rays and what is wrong, why that one is not appropriate for your case. So all the stuff has to be discussed with your orthopedic surgeon. So if the first one failed, maybe it's a good advice to hear a second opinion. So look for someone else, show the history, show the x-rays, and ask them opinions about. Again, I think that we have to be, each case is one case, and we have to know what is the reason of failure. We have to figure out what is the reason, why I have 2 cases of unsuccessful joint replacement. What is going on? What is not doing in the right way? Okay? Investigate that. Listen to someone else. You deserve to be, active.
All right. Thank you for the question, Coach. We got time for one more question. All right.
Oh,
Well, I mean, we can keep going if you want to.
sure.
If anybody got more questions, let us know.
My question is it rumored or is it mythical to believe that usually when you have surgery on one, you'll need it on the other side? I've heard that, well, if you had knee replacement on this one, you'll need it on that one, and eventually it'll be the hip, and eventually it'll, you know what I'm saying?
Mix of myth and reality. I will tell you why. Remember I mentioned that osteoarthritis is a systemic disease. So the same trigger, the same fact that triggered the first situation that you have in one knee will be happening in the second knee as well. So it's not that the surgery is causing the second procedure knee, it's the disease itself. And sometimes you may have it spread different joints.
Kind of like a part 2 question is, can you have it in multiple areas? Absolutely.
And you know what's happened as well? When you have a pain in that knee, I will sacrifice the other one because I start to limp. So I put much more weight on the healthy knee. So somehow you were helping to aggravate the healthy knee. Okay? Sure.
I forgot what I was saying. That the weight loss or the hip surgery, my daughter just had the surgery earlier this year, and her doctor told her she had to lose the weight before the surgery. She's fine now. But my neighbor across the street is, I guess it's the difference in your doctor, heavier than my daughter, and she didn't have to have the surgery. So is there just a doctor's preference or however?
We have some best practice, and ideally, we have to have a better way to do the surgery. But you know what? Sometimes happens that the patient is in excruciating pain, and he's overweight. So what I will do, I will wait until he loses pain and let the guy in excruciating pain? No. So what will happen, this may affect the outcomes because they are still dealing, even with one artificial joint, still dealing with a lot of demand for the joint. So this may affect the outcomes.
Okay, did I understand you say earlier that you have the knee surgery has a lot to do with hip surgery, or you have to replace that?
All the hip replacement ideally should be done with less weight, ideally. But again, it's a matter of, risk and benefits. And I cannot let the patient in excruciating pain and wait until he loses 30 pounds.
I enjoyed you very much.
Oh,
You brought
thank
back a lot of memory. I did symptoms and things with you for Ryan Hospital for 40 years. I set up for all orthopedic surgery, and it was very interesting. I'm retired now. So thank you so much.
Thank you. Thanks.
All right, thank you. Any more questions?
Okay.
Man, that's not right. That's not right.
Good afternoon. I'm a victim of the bone-on-bone friendship war, and
Me or you?
me. And I've been dealing with pain for a long time. I'm hearing that you need to go get the chromosome shots. Why are they not 100%? I've heard different people go get the shots. Maybe 2 weeks later it's not effective. Maybe a month later it's not effective. I was thinking about going to get them, but I don't want to think anything that's not going to be effective. So I'm always in pain. But since I've been going to this quality life, moving more, exercising, I went to chiropractor, doing ultrasounds. I'm like, goodness, it's easing the pain. So I'm finding things to ease the pain. I know the weight is the number. Weight is the number one issue, but you know, that takes time.
It takes time, yeah.
It takes time with the weight.
Step, you know,
Step by
sometimes-
step. But I am finding things to ease the pain. But you know, I'm just wondering if I invest in giving those shots, is it 100%? I hear people say it's not 100%.
The problem with medicine, the problem with medicine is we have to have long-term studies until I can tell you this is effective. I have to pass that in tons of people to say this is effective. So until we get to that point, I cannot say that it's 100% effective because we don't know yet. They're investigators. So, you know, measure it if it works. If you have some other measurements to help you that are already proved for that first. You know, just try things that are not proved if you don't have any other resource available, okay?
And thank you for all the good information.
Sure, thank you.
Oh, okay. Thank you for all the good information. And I guess I'm exempt from most of you because I don't have any pains. I had ophthalmic surgery on my knee. And my son told me, he said, Mom, inflammation is what causes pain. I take American curcumin, that's a herbal. I don't have pain, but I do exercise. I go to the Y almost every day. I keep doing the things, eat right, exercise, staying active, mind games, brain games, all that. But if you don't do the things that you're supposed to do, if you don't do the things that you're supposed to do to ease the pain, then you know you will have the pain. But just taking the herbal, American curcumin and all that for the inflammation which causes pain, which you know us too. And
Absolutely. You're
exercise
right.
is very important.
Yeah.
Eating right is very important.
Absolutely.
And I did want to ask you, half of my knee, you know, when they did the ophthalmic surgery, the hack is, you know, they cleaned it up. But, you know, I try to keep my everything strong by doing the exercise so it won't become weakened. But will the disease continue? You know, will I continue to?
It will, but you will be crucial in how the disease will, you know, progress. So if you're taking the good care, if you're avoiding things that should be avoided, like overweight, eating right, exercising, have your muscles active and strength, you're doing your part.
Okay, okay, very good. Thank you so much.
Sure.
My question is, once you have osteoarthritis pain, and I know some people get shots, is that just staying off surgery, or will those shots help in the long run?
Depends on what shots you're talking about. If you're talking about hyaluronic acid injection, this helps a lot tremendously in restoring the cartilage. So it will help the cartilage be healthier. But this is the shot that I'm talking about, hyaluronic acid. Any other shot, as I explained to the other lady there, it's still investigation, under investigation. So be careful, you know, inform yourself, look for your doctor and see, okay, can you show me the evidence? Because sometimes the doctors can be very creative, you know, and say, okay, you know what, I hear that if you use this and that, and if you take a shot of whiskey, will make you feel better. So you can take the shot of whiskey, but don't think that this will, you know. So, show me the evidence, doctor. Do you have something in the food that I take a look, that I can, you know, be informed? This is your, you know, best ally.
All right, so this will be our, because we got more things going on. This will be our last question, but the doctor will be in the back. So if you have any questions on lunchtime or whatever, she will be able to answer your question. But this will be the last question for the forum, but she will be in the back. So y'all can go back there and ask you some more questions, all right?
First question is there cure for rheumatoid? First question is there a cure for rheumatoid arthritis?
No, unfortunately not.
Okay, I can rheumatoid arthritis, my right knee. But what works for me, exercise is like every 6 or 8 months, I get a cortisone shot.
Yeah.
But the cortisone shot, it works.
It doesn't work or works?
It does work for me.
Because it's a different than everything that you're talking here. Osteoarthritis is not an inflammatory disease. Rheumatoid arthritis is. And so the approach is different. The measurement to take care of it are different. So different outcomes, different results, different treatment. But unfortunately, no cure. No cure. But again, same as I speak about osteoarthritis, you can select ways to tackle it to live a better life. There's a lot of resources. Cure? No. But not necessarily to be cured, to provide you with a better life. Okay, so talk with the doctor. And normally, the specialty that treats this kind of arthritis is the rheumatologist, not the orthopedics. It's not the orthopedic surgeon that treats that, it's the rheumatologist. So talk with your rheumatologist about it. You have to figure out which shock you're talking about. Because there is some shock specifically for this type of arthritis, there is some medication that is very effective. So, Don?
Let's give Dr. another hand.
Thank you so very much.